This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. Welcome to the Most Painful Podcast. I'm your host, Tom Hoppe. On our last episode, we had Dr. Andrea Ferland talk about her new book, The 8 Steps to Conquer Chronic Pain. And she talked about many ways that you can manage pain, such as lifestyle, movement, understanding of chronic pain, and all that can be helpful to manage pain. So she does a great job explaining different types of chronic pain and makes it actually quite easy to understand. So if you missed that episode, you can listen to it on our Spotify or Apple feed. Over the last 4 seasons, we have mostly talked to experts about chronic pain in adults. What about chronic pain in children? There's a high number of children suffering with chronic pain, and back in season 1, we had Dr. Melanie Knoll talking about the intergenerational impacts of chronic pain in children and in families. But what are the resources available for children? One such organization is SKIP, and to tell us about that organization, I'm joined by Katie Birnie. She's assistant professor at the University of Calgary, associate scientific director, Solution for Kids in Pain, with the Alberta Children's Hospital. Katie, welcome to the show.
Thanks, Tom. It's nice to be here. Really appreciate it.
Yeah, it's great to have you on. I know you work with Melanie as well, so the two of you are doing some wonderful work. But maybe you can just tell me, how prominent is pain or chronic pain in children?
Yeah, Tom, most people are surprised to hear that chronic pain is just as common in children as it is in adults. So on average, it impacts about 1 in 5 kids before they reach 18 years of age. And those 1 in 5 will deal with pain that lasts months, sometimes years, and can impact them to varying degrees in their lives.
So is that just, I would imagine it could be from injuries, like, someone breaks an arm in a sports or something like that. But what other ways are they getting chronic pain? And what age does it really start at? I mean, you said up to age 18, but when can it really start in children?
Yeah, chronic pain can start early in life. I think it's harder to assess, right? Of course, in terms of babies and so on. But chronic pain can come from a variety of causes, as you've described. Certainly can be from injuries, can also be from genetic conditions, metabolic conditions, things children are born with, right? But also things that they can acquire through the course of childhood. Also not dissimilar to adults. So about 20% of kids will develop chronic pain after major surgeries, for example. We also deal with things like migraines, headaches, injuries, and other complex medical needs, all sorts of things that can lead to the development of chronic pain.
What are the numbers? Do you have a rough idea of, we know in adults, like we know for military, for example, it's twice that of the Canadian population, but what is it for children?
Mm-hmm. Mm-hmm. Oh gosh, relative to their peers. So it does impact about 1 in 5 kids, as I mentioned. About 10% of those will deal with pain that is very, very significantly impairing in terms of their day-to-day life. So, that's impacting their ability to go to school, ability to participate in social activities with friends, activities with their family. We know that youth with chronic pain relative to their peers without pain are 2 to 3 times more likely to be dealing with mental health issues such as anxiety and depression. And there's some really interesting research from, actually it's US based, but still applies very much, I think, to youth here in Canada, that shows that kids with chronic pain, this impacts them over the course of their life. So about 2/3 will become adults with chronic pain. And for even those with whom chronic pain resolves, they're still at increased risk of mental health issues, substance use, and also are less likely to go on in terms of education and, challenges in the workplace and so on. So really be negatively impact relative to their peers, even for those for whom pain actually resolves.
So what kind of resources are available out for children? I mean, I know you're in Alberta. So do you know just what's in Alberta or what's nationally available for children?
Happy to talk nationally, absolutely. So one of the things we know that is a challenge for youth with chronic pain is access to care, right? So where do I even find somebody who can help me navigate even just identifying that chronic pain in children is real, right? We're talking about this as the start of our conversation, even just this idea that chronic pain exists. right, across the lifespan, but even more this barrier to understanding that this is something that is real and can happen in children at the same rates that it does in adults. So finding that access to care, and even health professionals who believe it, who know about it, let alone those who have some expertise in how to support families and to treat it, is really hard. There are about 11 what we call multidisciplinary chronic pain treatment centers for children dealing with pain that are based largely in hospitals in Canada. So those would be youth who are dealing with pain. They can go into refer to this specialty hospital clinic and see a psychologist, a physician, a nurse, a physical therapist, and get what we consider that gold standard recommended treatment for chronic pain, where they have access to that multimodal pain care. In addition to that, there are 2 what we call intensive pain rehabilitation programs. So those are week-long, several week-long programs, one based here at Alberta Children's Hospital and one at Holland Bloorview Kids Rehab Hospital in Toronto, where kids who are very significantly impacted by their pain go every day for several weeks and really get that intensive treatment. So it's great that we have these, right? Even those intensive pain rehab programs have only been around, in the last less than 10 years. And before that, kids would go to the States for that kind of treatment. But all of those specialty pain programs I've talked about are located in big cities, right? Vancouver, Edmonton, Calgary, Saskatoon, and then into, where we'd expect Toronto, Ottawa, and Montreal and Halifax. So there are ample areas in the country, even within cities, let alone in rural, northern or remote places where that care is really impossible to access. So that is, that's a problem in terms of that specialty care. And it's partly why SKIP exists. There's a ton of great solutions for how to manage and treat chronic pain in children. A lot of great research that's been produced. And so SKIP exists as an organization to bridge that gap, to say, okay, we know what can help. How do we make sure that those best solutions are actually reaching those who can use it every day? Health professionals, patients and families directly, policymakers, and so on. So we can really improve pain care for kids in Canada.
Yeah, we'll talk. I really want to hear about SKIP. I know we talked about it, or you mentioned it about it in another presentation we were doing together. And as you're talking, I'm thinking, okay, I've been to interdisciplinary pain clinics, and many other people I know have been as well. You don't see many children in there, though. It's usually adults. So is that because the parents are not aware of that, or is it a combination that's, I don't know, why are children not going to local interdisciplinary pain clinics?
In the community, you mean, outside of hospital?
Yeah, outside of
hospital-based care. Yeah, there's probably a combination of those things, Tom. I mean, one we've already talked about, which is pain even real in kids, right? Is chronic pain even a thing in kids? I think, there's a lot of issues you've probably touched on, I'm sure before in your conversations, a lack of education about pain for health professionals, and how do we feel competent to kind of diagnose, acknowledge, treat pain. And then many health professionals, that extension to working with kids or, even teenagers and younger, feels out of scope of practice. It's just not something they feel comfortable or competent doing because they just haven't received training in that area. So I think it's a combination of those things. And also, as you say, raising awareness directly with parents, with schools, with coaches, with, youth directly, with teachers, all these places where kids are day to day, where the structures and systems just aren't built to support those that are dealing with pain.
Yeah, and I mean, as you're saying, that twigs me to that study that Melanie had done, and both of us were kind of involved in that one way or another, where if the parents aren't even aware of chronic pain or have any knowledge in chronic pain, then how could one expect the children to even know what's going on? And then, like you said, you think about it as coaches, teachers, and everybody else, they're just parents as well. So if they're not getting that education, then how does it move forward? Which I guess leads us into SKIP. So maybe you can talk to us about SKIP, how it started, and what's the core of SKIP and what does it do?
Yeah, so SKIP stands for Solutions for Kids in Pain, and it's a national network that's based out of Dalhousie University in Halifax and co-led by a national organization called Children's Healthcare Canada. And SKIP's whole mission is to bridge that gap between the research knowledge and evidence that we have that can treat, prevent, manage children's pain well for what's actually happening in the real world. So Canada is actually hits above its weight internationally in how much research knowledge and evidence we produce about children's pain. We're one of the leading countries internationally in advancing knowledge about pain in children, but we are well behind in terms of actually putting that knowledge into practice. And you've probably heard this number thrown out, but estimates are that it takes about 17 years for research knowledge to actually make it into practice and policy. And that's an astronomical amount of time, no matter how old you are. But that's a whole childhood. So it means that generations of kids in Canada now they're missing out on solutions we already know can work. So SKIP's goal as a network, we have 6 hubs across the country, is to engage in activities and all sorts of things. When I say activities, I mean conversations like we're having today. I mean, creating new tools, videos, infographics, resources, presentations, education modules, media, development of national health standards, all sorts of things that take those solutions and make them tangible, usable, accessible by folks everywhere.
Yeah, and I mean that boggles my mind with the research why it takes so long. And I guess we could sit here and talk about it. Could be policy, it could be funding, it could be a number of things. But yeah, people are struggling while that's sitting on the shelf doing nothing.
Exactly.
So with SKIP, are you taking that information and then publishing like some of the positive results from it? Is that part of what you're doing?
Yeah, it's part of what we're doing for sure. I mean, SKIP as a network doesn't produce new research necessarily. That's not our mission and vision, but it's to partner with others. So to partner with researchers, to partner with policymakers, organizations, folks with lived experience, health professionals across the country, and take that information where people are already going. So if that's working with a health authority to say, we'll work with you to implement new national health standards about best, equitable, quality pain care for kids. Let's help make sure that the medications are accessible, that, an understanding that we need psychological treatments and physical treatments alongside is also critical. It also means advocating with policymakers to say, this is the best care and we know this works. How do we put that into practice? What are those barriers that are at play? And really working across, building that awareness, creating new tools, identifying gaps, and working in partnership to fill those.
So is it not an aggressive, I would say, is it more of a proactive approach when you're going out? Like, are you going to the schools and saying, here, this is, we have this information. Can you educate your teachers? Are you going to the interdisciplinary pain clinics in the community and saying, this is what we're doing? Maybe you can talk a bit about how that outreach is done.
Yeah, I would say it's all of the above, Tom. So one of SKIP's main activities is to work with groups to identify gaps and identify needs, and then work together to fill those gaps and needs. So sometimes it's organizations coming to SKIP and saying, please, or even sometimes patients and families coming and saying, this is something we need. How can you help us create a new tool to fill that? So, we've been talking about school. Several years ago, SKIP worked with someone in Nova Scotia who is an educational assistant and oversees some of that specialty programming in schools, and worked with them and pulled in other health professional experts and folks with lived experience to co-create a tool that was for kids to develop and share their pain care plan within their school environment. And now that's a resource that's accessible for anyone to use on SKIP's website. But that was an example of someone coming to SKIP and saying, we need this. This is a gap. Let's create something together. But SKIP's also been very proactive and intentional in tackling things that we know can support systems change. So one of those very early on, even when SKIP was initially applying for its funding, was to reach out and partner with the Health Standards Organization, or HSO, And we worked with HSO over 3.5 years to develop and publish the world's first national health standard for pediatric pain care. That was just published in April of 2023. And that is a great tool because it's identified as a national standard of Canada, which means it is identified as the leading, Canadian document on a topic, by the government, by policymakers. And, that's a tool that forms the foundation of accreditation for hospitals. It's a necessary tool that then helps us move towards, instead of good pain care being something that's nice to have, it moves it towards being something that we must have. It's required. So we're not there yet, but that was something Skip said, all hospitals in Canada pay attention to this type of document. So let's partner with the right organization to develop that for the first time ever, so that we're leveraging those systems and processes to actually make that sustainable change that we need to see.
And that's interesting because as you're talking, I would think a lot of people don't understand the process of getting something into healthcare. It's not,
Yes.
We talked about how long research takes and takes to get it down, but it's not just a matter of, like you're saying, taking something and then just putting it into hospitals. Hospitals have to have the approval, I guess, and the ability then to put it into place. Where I would think that a community-based pain clinic probably has a little more flexibility on what they can, as long as they're following the standard of care, I would guess.
Yeah.
So with Skip doing that, if we have a lot of parents who listen to this show with children, what is the best way, I guess, for them if they're new to this? First of all, it's do we recognize the child has pain, or is dad just saying you're whining, the type of thing. But what's the best way for parents? I mean, sure, they can go on to Skip, but what are other things they can do to advocate for themselves and their children?
Yeah, wow, you just touched on something really important there, Tom, and I think it's believing your children. And I know, I think certainly even just the fact that folks are listening to this today, you're hopefully taking away that pain in kids is a real thing, and chronic pain especially, in addition to all those cute short-term pains that kids experience. And youth, I think, because pain is invisible, right? Because I'm not telling you anything you don't know here, right? Because pain is invisible, because pain is a personal, subjective experience, because it can often co-occur, which makes sense, right? If you're living with pain for a long time, of course it can make you feel anxious. Of course it can make you feel sad, frustrated, angry, all of those things that come along with it. But the presence of those things and the invisibility of pain often leads us to dismiss it and ignore it. And so, I think the biggest thing as a parent is listen, ask some questions, tell me about this. What is this? And then follow up. Whether they need to see a health professional or, and I'll be honest, maybe not just one, right? You meet one and they say, oh, there's nothing wrong, with your child. They seem fine. Perhaps it's growing pains and so on. And it's not to say it may not be, right? And some pain does resolve in childhood. But I think you're looking for that persistent. Is pain persisting? Is it coming back? And is it interfering with your child's life in important ways? Their ability to go to school, spend time with friends, enjoy life, go on vacations with your family, do all of the things that we want kids to do that are really important, critical milestones as part of childhood, right? And so really paying attention to that and being persistent advocates for your child. A big piece is believing them, and a big piece is then advocating as they navigate through the health system. Skip is our website's a great resource, if people are looking for. So it's kidsinpain.ca or @kidsinpain on a variety of different social media platforms, and can certainly see lots of great resources there. And in addition, because Skip does everything in partnership, we're constantly resharing and directing towards other organizations and resources as well. That can also talk about that for children, and recognizing, that these diagnoses of chronic pain also apply in childhood, and those become relevant when we talk to teachers and the school system about supports accommodations, adaptations that are available for children within the school system, which is where we want them to be, right? We want them to be thriving, learning, growing youth. There are ways to support them even with chronic pain in those systems.
Yeah, and I mean, as you're talking too, you talk about being an advocate. I mean, yes, maybe the doctor you've taken your child to doesn't understand chronic pain. So as an adult, as the parent, I have to educate myself as well. And I think that's one of the, I think back to that study with the military people. It's one of the downfalls is, first of all, it's a suck it up attitude, which translates down to the children. So there's a whole thing of one believing and also educating and advocating for yourself and for your children, which can be hard sometimes if a person doesn't know the medical system and they're trusting doctors, and doctors themselves have a full patient load and are busy and I mean, their capacity is limited as just like anybody else. So when they look for skip, can someone just type skip in and it'll come up, or what's the?
Yeah, I would probably type in solutions for kids in pain. There's other skip's an acronym that's used for other things, but kidsinpain.ca or at Kids in Pain will take you to all of those resources. There's a resource page. And also lots of partners that we point towards, that, even in the absence, you talked, Tom, about, parents educating themselves, lots of other great resources and organizations out there. There's a group based or a program, chronic pain program for youth with chronic pain and parents based out of Boston Children's Hospital called The Comfortability. And they have a lot of great resources available online. It's a program that several hospitals across the country and Canada offer, but even in the absence of being able to access that, has a lot of great resources online for youth and parents. And also, of course, you may have spoken about this on your podcast already, but the Power Over Pain portal. There's a Power Over Pain portal for youth specifically, that is developed here in Canada, led by some great colleagues, and has been co-developed with folks with lived experience, including youth, that gives access to a lot of reliable, credible, vetted resources where youth can learn and empower themselves, which is also so important, right? Help demystify what's happening in their own bodies and their own experiences, and to not feel alone and stigmatized in that, but also for parents, friends, family, and others in their network.
Well, I mean, this is a key too, right? Is children themselves have to be empowered. I mean, the parents themselves have to, as parents, look after our children and advocate. So knowledge for them is key, but also empowering the children to have control of themselves and knowing that it just, like we've had many experts on the show talk about, is that knowledge will help you move forward and you can live a good life with chronic pain. You can just learn how to manage it. So is there any kind of last takeaways you'd want to leave for our audience before we wrap up?
Oh, great question. I mean, the other thing we've been working a lot on lately is a large project also focusing on safe, effective, and equitable use of opioids for pain management in children. And I know that's a big last topic to kind of share at the end here, Tom, but I bring it up because, I hope a takeaway here is that the conversation about pain in children is a real one. It's one we need to be having. And it often it's a slightly different conversation than the one we're having in adults. But it's one we need to have. And we need to talk about that in relation to chronic pain, in relation to substance use, in relation to mental health. And I always say, I feel like I stand up and say, don't forget about the kids. But I shared this earlier. 2/3 of youth with chronic pain become adults with chronic pain. And if we're not talking about pain in children, we are never going to get ahead of the issue of chronic pain in adulthood. So it's something we need to all be talking about and looking at if we're going to get anywhere.
Well, and as you talk about, we're finishing the show off and talking about that other discussion with opioids and other pain issues with children, tells me we got to do another episode.
Happy to do that.
because It's like, wow, we're getting to the end of the show and oh, look at that. We got some more stuff we got to learn. So there's always something to learn. But yeah, I mean, I agree with you. If we don't look after our children, they are our future. And it makes total sense. And honestly, until I've, met Melanie Knoll and other people like yourself, I'm sure we cross paths. It really wasn't a top of mind. It really wasn't. And I know that's odd being a parent, yeah, it's just odd. We think kids are resilient, so they just move on.
And they are. And
yeah,
right.
yeah. So, well, this was great, Katie. Thank you for being on the show. We will make sure that we put the website on our Spotify feed so parents can go to that. Lots of great information, really opened my eyes. And like I said, I think we're going to have to look at another episode because it's just so much more to talk about. Thanks for being on the show, Katie. A lot of great information. And of course, probably could do another episode.
Thanks so much, Tom. Happy to chat anytime and really appreciate the opportunity.
So on the next show, we'll speak to Lori Taylor, who works with veterans and practices trauma-informed yoga. So hit the subscribe and like button. For feedback about the show or more information on chronic pain, you can visit our website, veteranschronicpain.ca, or follow us on Facebook and Twitter at Chronic Pain COE and on Instagram at chronicpain_COE. To our audience, stay safe and keep the hope alive.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network.